So in the world of mental health, we are considered an essential service, and the CDC has recommended that anyone with an ongoing mental health care plan or who is seeking mental health find ways to urgently access that. And so insurance companies have been very um, supportive, and not only their client base, but also for the providers, in that they have offered waiving of fees such as co-pays specifically towards telehealth, telemedicine, telemental health, whatever it's termed. Um, some organizations have even gone as far as to waive certain provisions, such as boundaries that separate clinicians statewide. So um, every clinician is licensed by their state. And so some insurance
Yeah.
companies opted to lessen the restriction on who can be treated across the United States. And so as long as my license in Texas lines up with the state board and is approved by the state board of another state, such as Oklahoma or, California or wherever, some insurances have agreed to pay for that level of support no matter where a person is across the country. And so there has been some leniency. I think that they are fully aware of the psychological effects that a pandemic can have on people, even for those who are not directly affected by COVID-19.
Yeah.
Again, we are 100% telehealth right now, and we have 4 therapists on staff. 3 of us are credentialed with insurance. And for the most part, we have remained rather busy and continue to get calls daily, for new clients that are just feeling the mental health
Yeah.
toll of being quarantined. For me personally, all of the clients that I've had an opportunity to work with prior to, I'm going to say pre-pandemic or pre-quarantine, we're still in a pandemic. And as we go through it, many of our clients have been extremely thankful for the opportunity. And prior to this, they would have said, I don't want to do that. But now we've had feedback from several of them saying that they have enjoyed teletherapy or telehealth, and are just grateful to have it be convenient and a way to keep them safe. So it's been
Yeah.
appreciated. Prior to this, we were already a paperless office. And so there was some preparation, I guess, on our end that allowed us to make this transition rather smoothly. And so we were already sending forms through our patient portal that was already set up. So we didn't have that learning curve, which I'm thankful for. For our organization, we will probably remain 100% telehealth until probably mid-May or early June. And here's why. Each state, specifically to Texas, I can speak to, are rolling out us re-entering and reopening the economy in 3 phases. Wise to kind of watch to see how our local area responds and making sure that there's no additional outbreaks, and really us kind of still providing the support, but also not necessarily contributing to an issue. I think social distancing will still be practiced. Our offices are very, I won't say cumbersome, but they're comfortable, but it would be difficult to not have that 6 feet distance within our offices. So in a therapeutic space, and really for the comfort of our clients and the comfort of our staff, we'll stay telehealth for a little while longer.